It spreads in daycare centers, survives in swimming pools, and lurks in untreated water. Meet one of the most common intestinal parasites, Giardia. Let's know more about it. Number 1. What is Giardia lamblia? Giardia lamblia, also known as Giardia intestinalis or Giardia duodenalis, is a flagellated protozoan parasite that infects the small intestine of humans and animals, causing a diarrheal illness called giardiasis. Number 2. What does Giardia lamblia look like under a microscope? Under a microscope, Giardia lamblia has two distinct forms. One of the form is cyst, which is oval-shaped, thick-walled, and infectious. It appears as a smooth, rounded structure. Other form is trophozoite, which is pear-shaped with flagella and a central body. It is motile and resembles a teardrop or kite shape. It has two nuclei and can move rapidly in a zigzag pattern due to its flagella. Number 3. How is giardiasis transmitted? Explain life cycle of Giardia lamblia. Giardiasis is transmitted through the fecal-oral route, most commonly by drinking contaminated water. It can also spread through contaminated food, person-to-person contact, especially in childcare settings, and contact with infected animals. The life cycle of Giardia lamblia has two main stages, the cyst and the trophozoite. Infection begins when a person ingests cysts from contaminated water, food, or surfaces. In the small intestine, the cysts transform into trophozoites, which attach to the intestinal lining and multiply. Some trophozoites and cysts again and are passed in the feces. The cysts are the infective form, resistant to harsh environmental conditions, and can survive outside the host for weeks, continuing the cycle. Number 4. What are the symptoms of giardiasis? Symptoms usually appear 1 to 3 weeks after exposure. Symptoms of giardiasis typically include diarrhea, often greasy and foul-smelling, abdominal cramps, bloating, nausea, flatulence, and fatigue. Some individuals may experience weight loss and malabsorption, while others may remain asymptomatic. Number 5. How is giardiasis diagnosed? Giardiasis is diagnosed by detecting the parasite in stool samples, either through microscopic examination, to identify cysts or trophozoites, or antigen detection tests like ELISA. In some cases, molecular methods such as PCR may be used for more accurate detection, especially in recurrent or unclear cases. Multiple stool samples over consecutive days may be needed for reliable diagnosis. Number 6. What is the treatment for giardiasis? Giardiasis is treated with antiparasitic medications, most commonly metronidazole, tinidazole, or nitazoxanide. These drugs effectively eliminate the Giardia parasite from the intestines. Treatment usually lasts for 5 to 10 days, and in most cases, symptoms improve within a few days of starting therapy. Number 7. Who is at risk of getting giardiasis? People at higher risk of getting giardiasis include travelers to areas with poor sanitation, campers or hikers who drink untreated water. Children in daycare centers, people with weakened immune systems and people those living in crowded or unsanitary conditions are also at risk of getting Giardia infection. Number 8. Can giardiasis be prevented? Yes, giardiasis can be prevented by practicing good hygiene and ensuring safe drinking water. Key measures include washing hands thoroughly, especially after using the toilet or handling diapers, drinking boiled or treated water. Avoiding food and drinks from untrusted sources, and avoiding swallowing water from lakes, rivers, or pools reduce the risk of Giardia infection. Number 9. Is giardiasis contagious? Yes, giardiasis is contagious. It can spread from person to person through the fecal-oral route, especially in settings like daycare centers or households with poor hygiene. Infected individuals can pass the parasite in their stool, and others can become infected by accidentally ingesting the cysts through contaminated hands, food, or surfaces. Number 10. Can pets transmit Giardia to humans? Yes, pets can transmit Giardia lamblia to humans. While the parasite primarily spreads through contaminated water or food, animals, especially dogs, cats, and livestock, can carry Giardia in their intestines and shed cysts in their feces. Number 11. Is giardiasis a serious disease? Usually, it is not life-threatening but can cause significant dehydration, malnutrition, and weight loss, especially in young children and immunocompromised people. Number 12. Is giardiasis common worldwide? Yes, it's one of the most common parasitic infections globally, particularly in areas with inadequate sanitation and poor water quality. Number 13. Can giardiasis recur? Yes, giardiasis can recur. Reinfection can happen if a person is exposed to contaminated water, food, or surfaces again, or if the source of infection is not removed. Additionally, immunity to Giardia lamblia may not be long-lasting, increasing the risk of reinfection. Clean water and good hygiene can keep Giardiasis away, and clicking like, share, and subscribe helps spread awareness, not the parasite.